thanks to everyone joining today. I know folks are still trickling in, but we really appreciate you taking the time to join us today for this innovative community investment strategies, the current state of practice and the vision for greater implementation in Southern California. I'm Bill Sadler. I'm the Director of Operations at the Public Health Alliance of Southern California, and I have people from the Hospital Association of Southern California, Build Healthy Places Network, and the Center for Community Investment joining me today. So first, we're going to have some opening remarks from George Green, the CEO of the Hospital Association of Southern California. And then I'm going to go over the report and recommendations. And then I'm going to turn it over to Colleen Flynn from Build Healthy Places Network and Thomas Yee from the Center for Community Investment to go over some best practices that they're working on in this field.
Well, good afternoon, everyone, and we really want to thank you for joining us today to hear about best practices and innovative community investment strategies. As has been mentioned, I'm George Green, the President and CEO of the Hospital Association of Southern California. Here at HASC, we're dedicated to effectively advancing the interests of hospitals in Los Angeles, Orange, Riverside, San Bernardino, Santa Barbara, and Ventura counties. We're comprised of nearly 180 member hospitals and 35 health systems, plus numerous related professional associations and associate members, all with one common goal: to improve the operating environment for hospitals and the health status of the communities that those hospitals serve. When Communities Lifting Communities, or CLC, the Community Health Improvement Initiative led by HASC, launched in June of 2017, it commenced with that objective in mind: to improve community health and reduce health disparities across Southern California. Hospitals, local health departments, and community stakeholders gathered to embark on achieving this collective goal. In partnership with the Public Health Alliance of Southern California and with generous support from Blue Shield of California Foundation, the California Endowment, HASC member hospitals, and All Health, CLC Innovative Community Investment Strategies Initiative was launched in 2019. Today, we're pleased to present highlights and recommendations from the report, Innovative Community Investment Strategies, the current state of practice and a vision for greater implementation in Southern California. The new comprehensive report outlines innovative multi-sector partnerships between public health, hospitals, and health systems, community development, and other sectors that leverage resources and align investments to improve people's health. Building strategic partnerships is an essential first step in exploring innovative community investment strategies. I encourage hospital and health system leadership to work with public health, community development, and other sector partners to champion innovative community investment strategies in Southern California. The Alliance and CLC are scheduled to host a capstone roundtable seminar event on April 28th as part of HASC's 2021 annual meeting to promote the report and hear from several community investment innovators. More details on that event will be announced at a later date. I'd like to now introduce Bill Sadler, Director of Operations for the Alliance, and thank Bill for leading the research, interviews, and authorship of this research report. And again, thanks for your patience and really appreciate you participating today. Take care. Back to you, Bill.
Thank you, George, and thanks to everyone for joining today. We're really looking forward to going over the report and also hearing from several other speakers on best practices. So I'm going to go over this report that we released a few weeks ago on innovative community investment strategies and some of our key findings and why we put together the report and just some of the main takeaways that we're hoping everyone will learn about today. So really the reason we produced this report was threefold. First, there's a lot of interest in community investment strategies by the healthcare, public health, and community development sectors, and in working closer together and forming partnerships between these sectors to be sharing, kind of looking at investment strategies more holistically. Second, there's really a lack of comprehensive inventory on these strategies and best practices. There's a lot of research and papers and different efforts going on, but we really wanted to collect all of them together into one place and provide a really comprehensive view of what's being done out there and how we can use it here in Southern California. And third, that is, we really have a desire in Southern California amongst the membership of the Hospital Association and the Public Health Alliance among our health departments to be looking closer at how we can explore and implement these strategies in Southern California, where we haven't had a lot of examples so far, but we really have a great appetite. So what do we mean by innovative community investment strategies? So we started off talking about this in terms of innovative finance, in terms of creative ways to be financing our work in our different sectors. But as we were doing our research and hearing from people, we realized that the term community investment was more in line with what we were thinking of doing in our region. And this means first investments in prevention and the social determinants of health that improve community conditions. It means building and leveraging partnerships between sectors. It means utilizing non-traditional funding sources and strategies. And finally, it means aligning and optimizing limited resources and thinking more creatively about how we fund community health needs. And there's a slew of different strategies in terms of the financing that we looked at. So one of the first examples is blending and braiding funding. So this means pooling funding together from different sectors towards a shared outcome. So blending would be pooling out your funds together into one source where you can identify where the money came from. So it's a new pool of funds. Or braiding, where you're aligning, or in a way that you can still identify the funding, but you're more collectively investing together. There's accountable communities for health, a more holistic look at doing healthcare in your community by including different sectors and a more community-led process for identifying community health needs and how you invest in the community. A good example here in California is the CACHI site, the California Accountable Communities for Health Initiative. There's, I think it's a dozen or more sites throughout the state that are looking at this model for implementation. There's structured funds, so things like wellness trusts or other ways that funds are pooled together into a new source of funding that's looking at improving health. So a wellness trust, for instance, in Massachusetts or Minnesota or I think it's Oklahoma, and then there's one in Imperial County in California as well, are really looking at investing in prevention and the social determinants of health through a kind of a unique mechanism that's a structured fund. There's community development financing institutions, which are a different model that has been used for affordable housing and other types of community development, but led by the community development sector, but is a unique way of financing for this work. There's anchor institutions. A lot of hospitals or educational institutions are embracing their role in the community as an anchor to be fostering better community health, and really investing in the community itself surrounding the institution. So a place, a lot of in the Midwest or cities like Cleveland or Detroit, where a hospital system has really taken a strong role in investing in the community through these models, and really embracing a role as an anchor and a major employer as well. And related to that are procurement practices, where as a healthcare, public health, or community development institution, doing local hiring, local sourcing of food, really embracing the community surrounding the institution, and really looking to be investing back in the community through procurement practices. Social impact investment and pay for success. We looked at how different agencies are taking and new investment approaches that are more outcomes-based, where you're basically making payments based on a specific outcome of instead of the more traditional fee-for-service or other models, in order to be really looking at making social impacts in the community in terms of how you're paying out for different services. There's opportunity zones. This is a relatively new type of investment. It's was founded in the 2017 tax reform. That it's a designation for certain communities, and you get certain tax credits, and I think it's capital gain deferments to be investing in certain communities that are designated as opportunity zones. And there are different ways that the healthcare and public health and community development can work together, given that a lot of these communities are are located in places that have a hospital or other institution and have been economically disadvantaged. There's Medicaid demonstration waivers. The state of California has used these in the past for different ways to do innovative healthcare, and there are other states like North Carolina that have healthy opportunity pilots. Washington State has developed some accountable communities for health through these waivers. So this is a way that the state can be involved in these efforts by getting waivers from the federal government, from the Centers for Medicare Services, to look more innovatively at financing public health. And then finally, the other one we looked at was program-related investments, where you have foundations, philanthropy that are, instead of the grant-making process, are making more of a financing investment into the community with kind of a low-interest rate of return. But this is another mechanism that philanthropic sector has been looking at to make community investments. So I know that's a lot. You can read more about all these in the report, but I did want to give one example that's very recent on anchor institutions. One way that anchor institutions are embracing their role in the community, recently there was a group of Chicago healthcare institutions that came together to make a statement about racism as a public health crisis, and making a commitment in several ways that as an anchor institutions that they were committed to be providing services for the community, including for COVID-19 around testing and contact tracing and other health services, to make sure that as a steward of the community, they were really supporting the community in the current crisis and in other ways to be supporting their health. As I mentioned earlier, committing to local hiring in the community, especially in diverse communities, and hiring people of color in this particular communities that these Chicago institutions were focused on. Community investments, looking at making investments in the community, and these include things like pharmacies and groceries that are really critical assets for the community and critical needs that provide goods and services. Restoration and rebuilding the infrastructure of the community. So looking at housing and the economy and healthy food through the pharmacies and groceries, but just really rebuilding the local economy in a way that can support the kind of what our community health needs. And then finally, listening. A critical piece, as I'll go through on other slides, is just really listening to the community and other sectors in putting together these strategies is really important, so that you're really addressing and acknowledging community needs. And then I did want to mention too on this slide that we have an effort here in Southern California, in addition to Chicago, called Cherished Futures, where we're focused on African American mothers and reducing infant mortality. So that's another way that that is a budding effort here in LA. It's focused mostly in LA County, where we're trying to develop this model further and expand this model. Next slide. So I talked about what the strategies were. So what are we talking about in terms of what the investments actually are? What types of investments in the community are we focused on? Well, one of the primary ones that has really dominated is affordable housing. And given California and many other states, affordable housing is a critical need, and it's been a huge gap in a lot of communities to build it. So a lot of healthcare institutions have partnered with community development to be investing in more affordable housing. It may be gap financing, it may be capital investments, but it's a way to give back to the community and provide a really critical social determinant of health to be improving health. I mentioned local hiring and procurement already. Access to safe and convenient transportation options. So making investments in public transportation or active transportation, such as walking and biking routes. There's a great need to be connecting destinations, connecting to the hospital, connecting to work, connecting the home to schools and other essential destinations. So providing safer, more convenient transportation options is a really critical piece of the investment strategies. Healthy food, as I mentioned on the previous slide too, a lot of communities, lack healthy food options, and so this has been a major focus of these efforts, as well as to be providing financing for whether it's a grocery store or community gardens or other types of local food outlets that can bring more healthy food to these communities. Childcare and early education facilities as well. We know that there's, a lot of what happens at a very young age is a critical determinant of health. So focusing on providing these types of services in the community and integrating them into investments has been really critical. And also a federally qualified healthcare centers. So including healthcare systems themselves into housing or into more community-focused areas, so that we're expanding access to healthcare for people who need it, and it's more accessible in the community. Workforce development and training. So we're, that's part of procurement in local hiring. There's the aspect of hiring local community members for jobs in hospitals or other institutions. But there's also a need to be developing just workforce training in general for the types of jobs that are available, and developing skills for the workforce to make sure that people are able to access economic opportunities across their community and their broader region. Parks and recreation, providing access to green space and parks and recreation in the community as well. Provide outlets for physical activity and for socializing in these areas. A lot of these communities that we're focused on, it may lack the green space that other more well-resourced communities have. So this is another area of focus in bringing investments to the community. Arts and culture, so whether it be public art, like murals or other types of displays, as well as events, theater, other types of events that can be supportive of community, include community members. Small business creation, growth, and retention, so trying to support the local economy and help people start their own businesses, as well as support the ones already in these communities so that they can weather different economic cycles like we're going through right now, and that we're making sure that we're providing economic opportunities within the communities themselves that we are investing in. And then finally, and this list is not exhaustive, but another example is renewable energy and energy efficiency. So trying to retrofit homes, small businesses, other institutions in the community to make them more resilient to climate change or other types of events where having better energy efficiency would be helpful. That's kind of the broad overview of the different strategies and investment. So what we sought to do was, knowing kind of the strategies we were looking at in the investment, is look at different literature and efforts out there and interview people to see kind of what the best practices were. So we looked at over 120 resources. There was about 52 place-based initiatives that we found that are either existing now or that have in the past. And then we interviewed over 25 people that have looked at these different strategies in depth as well. So that was kind of how we put the report together. So here are our key findings. The first is that momentum is really increasing in this field. This is an area that has been around for several decades in terms of people investing in affordable housing and other types of investments, that there's been multi-sector collaboration. But really in the past 5 years, there's been an accelerated interest in looking at this. So a lot of people are forming partnerships and doing more investment. So the timing was really right for somebody to make a report on this. But that being said, a lot of the literature is really focused on case making. And I think because a lot of this is so new, that there's just a really big focus on trying to make the case for why people should be forming partnerships and investing more innovatively. So a lot of it is really focused on making the case instead of success stories or lessons learned at this point. One thing that is really important, though, is that some sort of backbone organization is needed to ensure long-term sustainability of these efforts. Any of you who have been part of a coalition know it can be really hard when there's no central force to really bring people together and convene them, when everybody is doing their everyday work and then trying to be partnering as well. So that's a really critical thing, especially when there's funding involved, that there's some sort of central mechanism to be a conduit for that. Another one is that philanthropy has really played a key role in accelerating these efforts. There's many efforts that have been funded by philanthropy in this initial stage, that they've been encouraging these types of partnerships and investments as well. So that's a really key focus right now is trying to bring these sectors together to work more closely. And there has been some emerging evidence of organizational realignment. That healthcare and public health, community development, and other sectors that are doing this work are starting to realign, their organizational resources and ways to be supporting these efforts. And we're seeing leadership, more leadership that's really championing these efforts and people really getting excited about doing this work. So that's a really key finding, and I think is something that's indicative that these efforts are going to continue to move forward. And then finally, there's a lot of partnerships that obviously there are barriers, and we won't go into a ton of them on this webinar, but they're working through barriers in different creative ways. For instance, looking at return on investment, that a hospital may have a different return on investment strategy than a public health department or community development. They may look at that differently, but there are ways that that you could look at social return on investment or other metrics that may be more in line with everybody's key mission instead of just the way that one sector might look at it. So there are ways that people are overcoming these barriers that you would not, so that they're not being hindered in moving forward. I think one of the main findings, though, is really the importance of partnerships. Any of you who have tried to explore one of these efforts or any type of coalition effort know that really relationship building is really key. So building these partnerships is a really important first step, and it could take a lot of time and energy to foster the type of relationships that are needed to actually get to an investment point. But building these partnerships is a really important first step. Multi-sector partnerships have really emerged as the early adopters and leaders with this. There are several really good models around the country of where people have come together to really explore these. My next one, there we go. Executive level champions are really key. So having a hospital CEO or public health director or community development director be the champion is really helpful to drive these forward, because it just brings additional buy-in. It can bring additional partners in and different energy, and it makes sure that your efforts are aligned from the top down in working on these. And then knowledge building, I think another key part is that everybody has their own lingo in different sectors. Everybody talks differently. So just having that relationship building and knowing how people approach things is really needed. I will say another thing, though, is partnerships can be really siloed. Even though you're forming partnerships, just given the nature of this work. The next key finding is one for coming from a public health organization is that there are a lot of good healthcare and community development partnerships, but public health can be missing sometimes from these efforts, where they come in later on and maybe not as a key investment partner, but they are sometimes missing from a lot of these efforts. And then finally, community engagement is often overlooked. So while you're building these partnerships between sectors, you may not be thinking about the community itself and how you're engaging them in what they really need. And is it a really authentic community partnership, or is this really more of an institutional partnership? So that's another key piece. So I'm going to spend a few slides talking about the important roles of the different sectors that we really looked at. The first being the important role for public health. There's a lot of different ways that public health is a really key partner. First, partner building with key sectors, bringing a health and all policies approach to the work, advising on the selection of interventions, investments, and sites, aligning with community health assessments and improvement plans and other types of assessments that public health departments do, providing data and health information on community needs and inequities, assisting with community engagement, supporting wraparound services, aligning departmental resources, and insight on government investment areas where appropriate. Next, the important role for hospitals and healthcare, one being that providing capital investments, so things like pre-development loans, bridge loans, other types of financing that hospitals either do routinely or are more innovative ways that they could be doing capital investments. Expanding community benefit dollars to address the social determinants of health, using the anchor institution strategy to support the community health needs of surrounding neighborhoods, aligning investments with resources provided by multi-sector partners, donating, leasing, or offering joint use of hospital-owned lands, and then finally becoming a formal and active participant in multi-sector efforts. And then for community development, identifying community cross-sector partners that have a stake in improving the lives of the populations they serve, performing a landscape assessment of potential partners, determining the readiness of other sectors to participate in a collaboration, leveraging community development assets through direct investments or as part of a planning or health needs assessment process, coordinating place-based investments with hospitals and health systems, public health departments, and others, and also creating a partnership roadmap to identify opportunities. And my two guest speakers today will go more into the community development piece in a second. So what is the best investment strategy? So through our research, we realized there's really no one-size-fits-all approach or magic bullet. There are a variety of factors it's dependent upon, those being the partners at the table, the capital and resources available, leadership buy-in and commitment, the political environment, and then other unique factors that are just unique to the partnership and the community. And then I did want to just touch on data sharing before we get to our recommendations and I close. This was a common challenge shared by partners in these efforts, and it needs to be addressed early on. Because of the unique challenges with HIPAA and other types of regulations, some of the data that may be really helpful in examining investment strategies may not be available, or there may be just strategies that need legal advice or other ways to navigate. But philanthropy has been playing a strong role in encouraging and exploring data sharing collaboration. There are different types of tools and exchanges that are coming up. There's mapping tools like the Healthy Places Index that the Alliance has created that look at social determinants of health across geographies. There's data information exchanges that different entities and agencies are merging. And then finally, there are clearinghouses, and you can read more about this in the report for sample agreements for this process, but the process is far from uniform. So finally, our recommendations. Building partnerships is an essential first step, and time should really be devoted to matchmaking. In the early adoption phase, with these partnerships, we really need to be patient, flexible, and open to experimentation. Public health departments should be core partners in these strategies. Hospital leadership can play a stronger role in championing these strategies, especially here in Southern California. Community development can strategically partner with the healthcare and public health. And each sector should really think outside their traditional funding mechanisms and explore greater alignment with resources in other sectors. And then just a few more recommendations. Conducting a landscape analysis of funding sources can really help to identify potential mechanisms, as it really can help you understand what's out there already, and what you can really leverage in your own work. Community investments themselves should support multiple social determinants of health. So I listed that whole laundry list of things that are community investments. So trying to think about, can you integrate multiple of these instead of just focusing on one is a good strategy. Evaluation measures, as I mentioned, like trying to go beyond just your simple return on investment and think about health and equity outcomes. Overcoming data sharing challenges is really paramount to success and examining the return on investments. Being aware of unintended consequences and being proactive. And in any types of these efforts, if you're investing in a community, you want to make sure that you're thinking about some of the consequences that may be unintended, but that could be harmful in terms of these investment strategies. And then finally, state policies and even federal policies should enable and potentially fund these strategies as well. We found that some of the challenges to greater implementation were that there were just different levels of policies that prohibit or just prevent greater partnerships and investments. So in conclusion, this is an incredible area of interest and opportunity, and taking time to build these partnerships is really essential. There's no magic bullet. There are many models to explore and flexibility in what types of investments are made. But in particular, public health, healthcare sectors have a significant opportunity to explore these innovative strategies more intentionally and strategically. So before I turn over to my speakers, I did want to encourage everyone to read the report. It's on our website at phasocal.org. And the report itself also includes two appendices. One is a literature review matrix that includes the 120 plus reports that we looked at with links to all of them. And then we have a place-based initiatives inventory that links to the various efforts that we found where there are partnerships that exist or that are exploring them across the US. So I encourage everybody to check out those resources. And here's my contact information, but I'm gonna turn it over to Colleen Flynn from the Build Healthy Places Network to share on the work that they're doing in this area.
Thank you, Bill. Good afternoon, everyone. It's great to be here, and I really appreciate the opportunity that Public Health Alliance of Southern California gave me to present with you all today and to connect. I'm Colleen Flynn, the Director of National Programs for Build Healthy Places Network. And we're a national center that shifts the way organizations work across the community development, finance, public health, and healthcare sectors to collectively advance equity, reduce poverty, and improve health outcomes in neighborhoods across the US. And we're founded and based in San Francisco and have long-standing relationships with initiatives that advance racial equity and community leaders across these sectors. And through our place-based work, we actually have an advisory service that we offer to focus on cross-sector partnerships. And we've been working with large healthcare system, community development corporations, as Bill mentioned, and community development financial institutions. And one of our specialties is actually producing a landscape analysis. As Bill mentioned, this one actually highlights inequities in communities, opportunities for collaboration, and ways that you can start to think about bringing in additional investment through partnerships. One partnership we created recently this past year through our advisory services that I wanted to mention is with Intermountain Healthcare. They are a large healthcare system and healthcare plan in Utah, and we've been helping them create an affordable housing preservation fund for the whole state of Utah that'll focus on deep affordability and think about areas, rural areas where there's been a lot of disinvestment. And I can talk more about that project if you'd like during the Q&A. Next slide, please. I wanted to mention that we have principles for building healthy and prosperous communities that reflect the values of 45 cross-sector organizations. And it's really thinking about the piece that Bill was talking about community engagement and inclusion. So if you are going to go through and partner with healthcare, public health, and community development, this could be a resource of how you might want to go about engaging the community. Next slide. I also wanted to mention, in case you want to check out our website afterwards, is that we create a lot of resources and tools and lift up what works for cross-sector collaboration across the country. One of our most popular resources is called The Pulse, and it's a monthly roundup of what we're reading and where we've been in the intersection of community development and health. It's a quick read. We also have a jargon buster, which aims to demystify common industry jargon so sectors can begin to speak the same language to help advance collaboration. That's one challenge we found, and Bill might have highlighted this, is just being able to speak the same language so you can start to develop a cross-sector partnership. Next slide. So I'm just going to talk a little bit of the range of partnership opportunities. I'll go fast because Bill actually did a great job of covering this through their report, which I read and I highly recommend reading. Next slide. We also have a playbook, if you're interested in looking at it, that talks about healthcare playbook for community developers. And this playbook guides community developers toward partnerships with hospitals, healthcare systems, and public health that you can check out if you'd like to learn more about that later. Next slide is, Bill talked about this a little bit too. I just wanted to mention community development field again. So the community development field is in the zip code improvement business, and holistically, they invest about $2 billion on social determinants of health in low-income neighborhoods. So they're a great partner for public health and healthcare, working in the same neighborhoods, thinking about the root poor and poverty are the same, and just a lot of times there's a lack of partnership. There's also some other language about the Community Reinvestment Act here. That was an anti-redlining federal law that required all banks to meet the needs of low-income communities that you can read more about. And I'll flip to the next slide. You guys can look at the rest later. One thing I wanted to mention that's bubbling up for us is addressing individual social needs versus community social determinants of health. And that a lot of times when people are focusing on social determinants of health, they're actually focusing on individual social needs. So these investment strategies that Bill was mentioning actually think about the broader community. And so it's just different levels of intervention. So thinking about how to get more upstream are the type of examples that I'll be sharing today. Next slide. And Bill also covered this in great detail, so I will just quickly talk about this. We also think about the range of partnership opportunities. Bill mentioned data sharing. One other role that we think hospitals and public health can play is the political clout and social standing that organizations have. A lot of times around the affordable housing crisis, there's still a lot of NIMBYism, not in my backyard. So to combat that, health departments and hospitals can harness their non-financial assets to advocate for more affordable housing. Next slide, please. So one example I wanted to share that we think is really powerful is Nationwide Children's Hospital in Columbus, Ohio in 2008 partnered with Community Development for All People to form Healthy Neighborhoods. And it's Healthy Families Realty. It's a collaborative that invests in housing redevelopment and workforce development. And together, so the Community Development Organization and the hospital have revitalized over 31 square blocks around the hospital. They've improved 144 homes, 10 new builds, and the hospital actually invested $4.5 million in this partnership. That led to the partners coming back together to create a career gateway project. It's an urban infill project that includes 58 new units of affordable housing and on-site job training space for physicians at the hospital. And the interesting thing about this urban infill project is that it was a former elementary school that was demolished in 2016, so it's been put to good use, good public use for the community. Next slide. Another one is this example in Stamford, Connecticut. The Housing Authority gave a site adjacent to the hospital. They swapped land. So basically the Housing Authority gave a site adjacent to the hospital for hospital-owned property elsewhere in the neighborhood. So the hospital was able to expand its campus, and the Housing Authority was able to build mixed income housing in a different place. So through this kind of property swap, they planted the seeds for a larger collaboration. And now Stamford Hospital has created a beautiful mixed income housing, healthcare area, and thriving business, and also has an urban farm. And this mixed use project, in total, the hospital provided $186 million, so a pretty big project. So next slide, please. The other one I wanted to mention is LISC ProMedica partnership. So this was LISC, which is a national community development financial institution working with the integrated health system ProMedica to address social determinants of health in Toledo, Ohio neighborhood. Through this partnership, they created job training opportunities, a healthy, affordable grocery store, a health clinic, community health workers, a financial opportunity, think of wealth building for low-income folks. And the first investment from ProMedica, the healthcare system, was $45 million. Next slide, please. And so the last one that I wanted to mention that involves a public health department is this Chicago and Cook County Flexible Housing Pool. So 7 different local health departments, public hospitals, different nonprofits, and the city came together to create this fund. And what it does is it supports comprehensive housing system for homeless people. So people who are high users of hospitals have a place to live and supportive services. And the County Department of Public Health is a critical role in providing support and data gathering and implementation. Right now, the fund is at $8 million. The goal is for it to be at $12 million. And through this fund, each individual gets $1,000 of housing subsidy and in-depth wraparound services on top of that. Next slide, please. And then one project that we're doing and implementing with some partners on the ground in California I wanted to talk about. Next slide. Is the Healthy Neighborhoods Investments. So we have funding through Blue Shield of California Foundation to work in Stockton, City of San Bernardino, and Coachella. And our whole goal is to promote community development and healthcare partnerships as the go-to sustainable model for addressing social determinants of health. And part of that is in Coachella Valley, we are working with healthcare partners and community development partners in public health to advocate for more affordable housing. There's been some perceptions around not developing more affordable housing in the area, and so money's actually left on the table. So we are bringing these stakeholders together to advocate for more affordable housing in the area. And the other thing I just wanted to mention is in Stockton, we're working with various different healthcare systems and community development corporations to think about supportive housing projects, early childhood centers, a grocery store, and a school. So thinking about kind of comprehensive neighborhood revitalization efforts by bringing all these stakeholders together along with the mayor and the city. And we should have more to report on that work as we pull it together. And with that, next slide, please. Just wanted to say thank you for listening, and my contact information is here if you would like to follow up and talk more. One of our strategies moving forward is to more intentionally partner with public health, so I definitely would love to talk to any public health colleagues out there that are interested in learning more. And thank you, Bill.
Thanks so much, Colleen. And so our final speaker is Thomas Yee from the Center for Community Investment.
So first, thank you to the Public Health Alliance, the Hospital Association, and Communities Lifting Communities for your great work and for inviting us to participate. The Center for Community Investment has been working across the country with all kinds of communities and institutions, including hospitals and health systems, for the past few years. Our work on investing upstream is funded nationally by the Robert Wood Johnson Foundation and in California by the California Endowment. We're a program of the Lincoln Institute of Land Policy. And, myself, I lead our California statewide programs and have been working in community development in the Los Angeles area for almost 2 decades. Next slide. So my remarks are relatively brief, and I wanted to focus a lot of my comments on the context of today and what may be painfully obvious to many of us on this webinar, but really is still not apparent or just beginning to be known to the broader public, is this COVID-19 pandemic and how much it has laid bare how profoundly structural racism and social determinants impact health outcomes. Our communities face starkly different realities, now literally between life and death, depending upon our race, our access to job opportunities, our access to education, our access to stable, healthy housing. Essential workers, largely people of color, many living in crowded living conditions, really have no choice to socially distance safely, let alone those who are homeless or incarcerated. These disparities are heartbreaking, but for us, not surprising for those of us who have been working to improve and invest in the social determinants. What is inspiring about our work now with health leaders, with community leaders, with local governments is that despite these desperate conditions, our partners are continuing to do the difficult work, not only on the front lines of the pandemic, but also carrying the flag forward on upstream investment. And we see this not only in our health institution partners in accelerating investments in healthy communities, our hospitals program, which I'll get to in more detail soon, but also in a growing number of local governments, including here in San Bernardino County, who recently declared racism to be a public health crisis. Next slide. So to quickly state CCI's essential reason for being, I would say this about our work. We shift new development attention from transactions to systems. And we do this in the context of communities as the engine for change, not just as places to land capital. Through our programs, we support individuals and teams, particularly leaders of color, who are identifying where and how investment ought to be flowing for the benefit of their communities. And we support what Bill described as the backbone role of those leaders and the broader collaborative relationships that support these initiatives. Our experience has taught us that in order to move from transactions to systems and community investment, we focus on 3 things. By focusing on shared priorities, we get investment to line up behind social and racial equity and community priorities, rather than being imposed top-down from the investor's point of view. You get value from moving to a pipeline of transactions to move the needle on shared priorities, rather than just investing in one deal and calling it a day. And finally, we see the whole system as an enabling environment, and that gives you a whole toolkit of different interventions that you've heard about today. So it's not just about capital investments, but it's also skills, relationships, policy actions, and data sharing that you can use as interventions. Next slide, please. For the past 2.5 years, we've been working with health systems across the country to accelerate upstream investment activities. So early on, we made a decision to work with the pioneers who have already been taking early action to move upstream. And what you can see from the list of participating health institutions in our program is that we have intentionally partnered with a variety of institutions, including a children's hospital, academic research hospital, faith-based hospitals, safety net, and a safety net hospital in order to learn, support, and accelerate a variety of practices and from a variety of points of view. Oh, not quite yet. Thanks. These are hospitals and health systems, as I said, who are already doing upstream investment work. What we found from partnering with them is that the ones doing the most work are multidisciplinary in who they activate towards their upstream investment activities. And so in our program, we work with local hospital staff, with system level staff, community benefits and population health staff, also finance and treasury and clinicians. So in phase 1 of AHC, we worked solely within the health institutions. We're now in phase 2, and in this phase, we've asked participants to collaborate with their external community partners, which has turned out to include developers, foundations, community organizations, and local governments. Focus on affordable housing as our target of upstream investment is not an accident. As you heard Bill say this in the new report, this is the most robust area of activity for upstream investment. But here's why from our point of view. The field is organized and it's relatively easy to invest in because of the structure of the affordable housing industry. That housing and health connection is well established in social determinants, and so it's also a starting point from which to do other types of upstream investment. And so 2.5 years in, the results from AIHC include work on a variety of affordable housing deals, including preservation, home ownership, and new construction, rental. And health partners aren't just investing their own capital into projects, they're convening or supporting collaboratives and partnerships, working on local policies, and leveraging other sources of capital. And this is an important point I want to continue to stress, that given the depths of the health and economic crisis we're facing, you can still make an impact on upstream investment without necessarily just spending dollars. Next slide. So to focus on spending for just a bit longer before I get to share some case studies, I want to point out for us an important a distinction between what we call spending and what we call investing that is critical for upstream investment. So we call spending payment for goods and services without the expectation that the money will be repaid. In contrast, what we call investment is payment for goods and services that will have value over time, and that comes with the expectation of some form of financial return. And so what we've learned in working with different partners is that these different ways of using institutional funds means that you're using different pots of money. And so looking at upstream investment from a grant spending point of view, and that usually means community benefit or foundation dollars, or even public dollars, looks really difficult right now in a time of financial strain and budget pressure. But from a finance perspective, there might not be the same kind of immediate budget constraints, and so you might be able to use a different part of your institution's dollars in a way that you might normally consider. So I also want to highlight the example that Nationwide has in their work in Columbus. You heard a little bit about their work on a specific project from Colleen. I want to share one financing solution that Nationwide is participating in, and what's interesting about their participation. They, along with their partners, have created the Southside Renaissance Fund, which is a well-structured blended fund, the kind described in the new report, that supports affordable housing projects with capital collected from a variety of financial partners. And here's the great news for the hospital partner. Nationwide participates in a guaranteed position in case of any future losses. So that means they haven't actually moved any money around to participate in this fund, and they won't unless there are losses on loans, which is relatively low risk, but has a big impact in making funds available and flowing to projects. Actually low risk because affordable housing deals historically have a very low default rate. Another example locally of how you can have impact without necessarily spending a dime is our work with Dignity Health Common Spirit. Dignity Health has 2 hospitals here in San Bernardino County, City of San Bernardino, and is committed to increasing affordable housing in the community. And so while the story of affordable housing deals is always complicated in San Bernardino, that's a bit of an understatement. The big project for the city in recent years is the redevelopment of a site now called Arrowhead Grove. And National Core, a developer based in the county of San Bernardino, had successfully completed the first phase of that project. But here's the issue. The city had just come out of bankruptcy and so didn't have additional funds for future phases. And Dignity, with their long history of community development lending, had already provided a bridge loan of a little over $1 million, and was in a position to help think creatively about how to unlock other resources and partners. And so as part of their homework in our program, Dignity was tasked with identifying a partner that is needed at the table and to propose a pitch for that partner. This is one of the ways in which we support and coach teams. So in that convener role, Dignity invited the state's Strategic Growth Council alongside their housing partners, which included CDFIs, developers, foundations, and agencies to San Bernardino. And their pitch to the Strategic Growth Council ultimately helped to secure a $20 million award for the next phase of the Arrowhead Grove project. And so their job wasn't to spend more investment dollars at that moment. Instead, it was to use their influence and leadership to unlock other sources. Next slide. So again, I want to emphasize that the big message for me for today, the pandemic isn't the time to shy away from upstream investment, and in fact, quite the opposite. And that's why we're really happy to see this report coming out now. Hospital and public health partner leaders, you all have a special bully pulpit right now to mobilize energy to change the outcomes of communities most impacted because of this focus on the health of our nation. And so even if you don't have the dollars to spend, use your leadership and influence, and there are other ways to continue to be engaged in upstream investment. And from our best practices, you don't want to do the work alone. Embed in the existing efforts that you find in your communities if possible. If not, build new collaboration and get new partners to join in. Don't be limited to just thinking about grants, especially if there are none to deploy. As Colleen and Bill mentioned, there are other ways to provide resources. It's staff expertise, land, investment assets, and influence, and it's not just a community benefit budget. And then if you find yourself in a situation where a blended fund makes sense, you can still sit in the fund in something like a guaranteed position without necessarily moving a dollar. Next slide. And so that's all I wanted to share for today. And thank you so much for your time and all the important work you all are doing across Southern California. I'd be very interested in talking with anybody who'd like to follow up with me. You can visit our website to download other resources we have on community investment and investing upstream. Thank you.
Thank you, Thomas. And thanks so much to our speakers and to everyone who joined. We have a few minutes for Q&A. We can go a little bit longer if people have questions. I don't see any in the chat unless, Lauren, if you've been monitoring, you see any. But if you do have any quick questions, if you want to enter them in there right now, or if any of our speakers have questions for each other.
I have a question for Thomas. Thomas, just with your framing around the COVID response, what are some ways you've been talking to hospitals about partnering just in the short term?
So the interesting thing that we were in some ways surprised by is that our partners, our hospital partners, have been able to essentially maintain the commitments that they had ahead of the pandemic. And so we haven't focused necessarily on any shifts in strategy to address pandemic related impacts. Our partners have wanted and have had the capacity to basically stay the course on making progress towards the community priorities that they had already identified. And so I'm not sure if that's the answer that you're looking for, but that's been our experience. And so we've had a lot of work to do just to stay the course and not necessarily make those pivots that might also be necessary.
And Thomas, I'm really curious. I really like the statement you made at the end about, using our bully pulpit at the moment to really be championing these efforts, because I think, when we started this report, the pandemic, what has unfolded, and, it was a different world. And so I do think we all need to think about, in this new environment, like what do these strategies mean, and how do they uncover a lot of the root causes and structural inequities that I think we have been trying to solve, and that they're not going away. And I think that, we really need to take advantage of that moment, and moving forward with these. So, I think that even though things are different now, I think that these investment strategies are still evergreen in a sense. It's just that they may be, a little, more focused on one thing or another.
There was another question in the chat asking if any of you can show examples of the types of organizations that you're working with that reflect diversity in terms of, supporting immigrants, farm workers, indigenous communities, or anything like that.
Sure, I can go. In Coachella Valley, we're working with a lot of farm workers for farm worker housing and supportive services where healthcare systems are involved. As well as areas that are unincorporated areas where there's a lack of infrastructure. So there's really poor quality housing, roads, water. So that's one area where we're really focused on that community of people.
And I see another question came in about what are the best ways you have seen hospitals or healthcare engage communities most impacted by inequities in shared decision making?
A really important question and a really important point that we emphasize throughout our practice in supporting collaborative working on community investment. I think we've seen examples where there's a community affiliate, and there's also a hospital that we've seen in some of our places, partners working with faith-based institutions and churches who are really grounded in the community. They're partnering in coalitions like the Purple Line Coalition and Prince. So there's different ways. I think it's really being able to come to the table without prejudging the community priorities, and really, like I think Bill that had said, really paying attention to who you're listening as an active strategy.
Great. Now, I think we have time for one more question. I see one more in the chat, and that's, what do you see the role of the community health worker in the new normal? What is the role of using telehealth mobile units and reaching out to vulnerable communities of color? And I guess maybe we can broaden that to what is the role of telehealth in these efforts, and in general. I think now that we're living in a virtual environment, and some of the efforts where partners used to come and meet at the table directly across from each other or engage the community directly, how does this work shift in the current environment to a more virtual telehealth framework?
Yeah, I can go, and then Thomas, I'd love your thoughts. I think it's a multi-pronged approach to think about how to support historically marginalized communities and communities of color. And I think mobile units plays a large role in that. But it also is not like the silver bullet. So I know that a lot of healthcare systems are just thinking of how to structure mobile units with other supportive services, doing some home monitoring as well. So actually going into people's homes to help support them. Just thinking of all the different ways that you can connect on the community level, especially for people that are vulnerable and need support. And then with a community health worker, we're working with a community development financial institution to actually train unemployed and underemployed to be community health workers with hospitals. So I see community health workers playing a larger role moving forward, especially when they're people that are from these historically marginalized communities and can help support their local community in this new normal.
Great. Well, thank you so much to everybody for joining today. Reminder to go to our website at phasocal.org for the full report and appendices, and to our partners at Build Healthy Places Network and Center for Community Investment as well, to check out their websites for additional resources. So with that, take care, everyone, and have a good rest of your day.